And I can feel that she's quite locked in that anterior kind of pec down through the arm. And if you work at a computer, that can ultimately happen if you're doing that every day. And I mean, again, emotional holding patterns. A lot of people, when they get stressed in life, will hold that stress in this clavicle area, around the lungs, around the heart, lungs, around the upper spine, into the neck, all of that. So I'm just gonna take a switch with my left arm holding under and move it a little bit. There we go. So you can see where my arm is. And the pillow's just, I think, wanting to leave, so we're gonna let it do that. Beautiful. And now what I'm feeling is that scap. Again, guys, I'm not adjusting any kind of bony structure, but what's happening now is the fascia is loosening. I can feel it loosening underneath that subscapularis, which is underneath the scap, which was holding, gluing down on that. See, now I'm able to move that arm with more full range of motion. And how is this feeling?
This is awesome. This feels so, like, I just, like, you can...
Your other arm and shoulder is going to feel so strange. Maybe I'll have to do it, not in the video.
I think you're going to have
to.
So
guys, see how she's... Look at that range of motion now in that shoulder, and I'm just able to flow. And you do want to be careful now if somebody's had shoulder surgery and they had, you know, like a tear, labrum tear, anything, any kind of shoulder surgery, I might not move as much with this mobilization. I might even be more stationary, and that's okay. You always want to be more cautious than not. But no pain, right? And
no.
It's just opening beautifully. And I felt that ungluing underneath. So I'm gonna put the cup down for a second, and then I'm gonna just underneath support. And a lot of times clients will want to lift their arm and help you, and that's okay. After a couple seconds, I can feel just the relaxation. So now I'm getting that whole clavicular, and I'm not pulling on the arm or the shoulder. I'm using my body weight to move it, but you don't want to pull too hard, right? You don't want to pull too hard. You want to just gently mobilize. So her arm is completely supported with my body weight, and I am bending my knees and moving through my hips. So I feel good. My shoulders aren't raising up or tightening. All my weight is in my glutes and my legs, and I'm moving through and lunging through my hips. So my arms feel great, my shoulders feel great. Her whole arm and shoulder area is supported with my body weight. I'm doing all the movement, but I don't feel pain in my body at all. So that you wanna adjust your body so that you're not tightening up, because if you're tight and stressed, that's gonna transfer to the patient's energy too. So I could do this for 2 hours and feel fine. And check in, like, this isn't hurting under your elbow area, and
no, not at all. No.
And see, now I'm feeling like there's no gripping anymore in her scapula, clavicular, scapular, brachial area. It's just opened up and moving. I can just move that shoulder to the ear and move it back and forth, gently, of course. And everyone's gonna be different. There's some people that I wouldn't do this on. If they're really sensitive, if they have scar tissue, at some point maybe we can, but you'll get a, you'll feel like, okay, we're gonna be very gradual. We're only gonna do the cup around this and leave you don't have to do the same thing every time for every person, of course. But on somebody that hasn't had, and I'll say this, it's different. There's people who have had shoulder surgeries, it's healed, they have some scar tissue, but you can do that. Some people you don't. You have to just check in with what the tissue's like, what the surgery was, is it healed, do they have any issues still in their range of motion where they can't go all the way back. Don't push it to that. Of course, you would find all of that out in the intake that you do with them. We're just trying to get better range of motion, and we're trying to help ease pain, not cause any more. So now I have my little miniature cup to just get through that medial area, and then I know we're not really doing neck, but if you want, guys, you can go along that levator, upper trap, and then even into, you want to be careful, don't get too close to the ear. That's not fun for people, but I'm under the mastoid area of suboccipital, which those tend to get very tight and inflamed on people. So we're just going up there a little bit. Why not? Move the camera a little bit. There we go. Yeah, I don't have a professional cameraman or camerawoman. So we're going through that mastoid and around again. And then I'm gonna take my left hand and I'm gonna go into the axilla area, which is the armpit, and this is gonna help open the lymph too through there. And I'm going underneath the teres minor major area, and then underneath the scapula fascia, just moving around like that. Okay, so I do use my hands too. I like to, why not? So now I'm getting in there, these fingers into the armpit. Is it ticklish? Sorry. Is that okay?
It tickles.
Okay, see, and now I felt that release. I felt the release through this area. And I'm not trying to dig hard or hurt their armpit at all, that axilla area. We're just going under there. And then I'm lifting up a little bit to lift under the scap, and then pushing up a little bit towards the ear to get that release. And I felt it. That positional release in the scapular area, in the fascia, connective tissue, and myofascial work. It can, yes, it's technically still work, but you also mobilize too. I do both, and this is just like flowing and pliable now. I don't feel the ribs and the scapula sticking together anymore. Great, very great. And then we're gonna go back a little bit and move. So now what I'm checking for is that clavicle, brachial plexus, scapular area. Is that just like opened and moving so that the shoulder can move back and forth? Yes. And does it feel different to you?
Yeah, I feel like I have more mobility.
More mobility, and it's not like sticking and pulling at the neck and pulling under the ribs?
Yeah, I feel really, it feels really loose and good right now.
And relieved?
Yeah.
Great.
Thank you.
You're so welcome. So see how I can, that infraspinatus border, I can move that tissue up and down now. Whereas like if I try and move this side, it feels like it's sticking to the rib cage and like the shoulder won't move freely. So that's, and then this acromion process is, those aren't even, okay? And a lot of times they're not, but like I can just move back and forth now. This side, not so much. So I got a release pretty quickly. We're at 24 minutes and it was supposed to be like a 10-minute video, but lovely and fine. I don't rush. You don't want to rush through your massages. You want to be present with the person. I'm not trying to be bossy. It's just what I really think and feel. And I like to move at a slow pace, not, you know, the person might be like, oh, okay, it's fast. Basically, their nervous system you don't want their nervous system to feel rushed, is all I'm saying. So you want to ease into the tissue, you want to ease into the work, you want to take your time with it. I don't want to cause pain. I don't want to make the person feel like they were stressed out or like they were beat up. I will never, ever, in the past 16 years of doing work, have never done that, and I never want to. So I'm always gentle, intentional, slow, as painless as possible, because some people come in with pain. I want them to leave with less pain. So yeah, that's what I'll do for shoulder issues when it comes to the fascia. And then in a 60-minute cupping / cranio combo, I would do both sides and then have the person flip over, and then I would do the cranial work around the head and neck. And that will open up that whole brachial plexus area, help with mobility, help with stress in the shoulder and neck, tension, make the person feel like they're not hunching forward as much anymore, all of that. And generally people will have not as much numbness down the arm and into the wrist and hand, or pain through that brachial plexus. So if you like this video, please click the subscribe button. If you like this video, please click the subscribe button and like it. And in my next video, I'm going to be doing the sacral portion of a craniosacral session. So around more the abdominal, pelvic, sacral area. Hope you love the video. Click subscribe. I'm Mar Little LMT, craniosacral and cupping. Have a peaceful day.